Welcome back. For the last 31 years, St. Anne's Corner of Harm Reduction has continued to provide community outreach and services here in the Bronx, and the pandemic hasn't stopped their work. Here to discuss the impact COVID has had on harm reduction and more is Krystal A. Montalvo, co-director of programming at St. Anne's Corner of Harm Reduction. Welcome, Krystal. Thank you so much for joining us.
Thank you for having me.
Of course. So to start off, can you tell us about St. Anne's Corner of Harm Reduction and your mission?
So, St. Anne's Corner of Harm Reduction, as you mentioned, has been around for 31 years, and we actually started 31 years ago on the outside of the corner of St. Anne's Avenue and 139th Street, and it's now a community garden. And that's where our CEO, Joyce Rivera, started doing syringe exchange through the trunk of her car. And from then up until now, we've been providing a large array of harm reduction services through a holistic approach in the streets, at our street sites, at various sites in the Bronx, New York, and at our central office that is currently at 886 Westchester Avenue.
Thank you, Krystal. And as I mentioned in the intro, your work hasn't stopped during the pandemic. We're a year into the COVID-19 pandemic, and you continue to do outreach and services. Can you tell us how SACHR has continued to provide harm reduction during COVID-19?
So COVID-19 actually challenged us to think outside the box in the way that we provide traditional harm reduction services, where we used to provide an array of our services at our central office and then solely just provide our syringe exchange in a small portion, a small menu of services on our outreach sites. We now shifted to providing a full range of services at our outreach site to mitigate the transmission of COVID-19. And we wanted to ensure that we were giving our staff the health and safety that they needed to be safe. And we also wanted to remain as a pillar in the lives of our participants because they don't have access to a lot of the resources that we provide them, like warm meals, like our syringe access services, like our hygiene kits, and anything that they need, even up to clothes donations, we try to provide for them at our central office, but now 5 days a week at various outreach sites.
And when we talk about the opioid crisis in the Bronx, Krystal, it's something that has been long, held here, an issue in the community. And your work, of course, continues to help people with an empathetic lens. How has the pandemic impacted the opioid crisis in the Bronx? Has it gotten worse? Is it still the same?
It has gotten, we have received a large amount of fatal and non-fatal reports of overdoses, and for our naloxone distribution numbers, we have increased because of that. We are giving out about 150 naloxone kits a month, and that is to reduce opiate overdoses. And with that, we are providing fentanyl test strips with our grab-and-go bags to try to reduce non-fatal and fatal overdoses.
And I'm glad you brought up naloxone. Can you tell us more about your Narcan training offered at the center? And what is naloxone exactly, and why is it important for everyone to learn how to administer it?
Naloxone is a opiate reversal spray that is now sprayed in the nose. And what it does is it blocks the receptors in the brain that is triggered by opiates. So it will block the receptors in the brain when you're overdosing. And what happens a lot of times, more than usual, is that the individual then go into a system of withdrawal. They're being blocked. The opiates that they took are being blocked so they would come back. Our naloxone program, we do provide trainings now via Zoom, and we do provide trainings in the community. The Zoom trainings, we do kind of minimize them to 50 people if we have to transport the naloxone to the organization or the individual, we would do that. But in the community, you can just come up to any of our staff and they can access a naloxone kit.
Got you. Thank you for sharing, Krystal. And if somebody's listening from an organization or an individual, how can they get in touch to find out about that training or inquire more?
They can send me an email directly and I can coordinate a training with them with one of our staff members, whether it be myself or one of our outreach coordinators.
Can you provide your email real quick, Krystal?
Yes, my email is KMONTAL, as in Victor O, at SACHR.org.
Thank you so much for that. Something else that the team does is a syringe outreach response. Can you tell us more about the SORT team and what it entails?
Our syringe outreach response team is made up of our participants, and the idea is for our participants to give back to their community, and while also accessing some job training. So it is a program for our participants to acquire jobs and to go into the community and pick up syringes in areas where either we find high risk substance use or where it's reported to us, and then we go out and pick up the syringes wherever we need to 5 days a week.
Yeah. I actually met you at one of those events, at one of those cleanup events over at St. Mary's Park. It was, can you tell me a little bit about that story? Like the school reached out to the team and asked for help?
So the school is on our cleanup schedule already, but as I said, we do have a lot of sites that we do visit. So we go there once a week. So they did reach out to us again, and they wanted to do a cleanup because the principal wanted to bring the children out to the playground since they didn't have access to their playground. So we went out and we met up with another organization, which is actually New York Harm Reduction Educators, and we did a small little cleanup around the surrounding areas of the playground so that she can feel safe to bring the children out there.
I learned about some of the disposal areas too in the parks. Like I didn't know that there were different disposal boxes where people can throw out the syringes safely, and that's also part of the education and outreach at the organization, right?
Yeah, so the kiosks are in several parks throughout the Bronx and Washington Heights, and those kiosks are accessed by New York harm reduction educators to empty them out. You can, if you wanted to, you can get a kiosk. If you have a private property, you can set one up yourself. But they are a safe space for participants or those who are using substance to dispose of their syringes. And we are finding that they are using them. So it's just like any other, when you see a mailbox on the corner, you see a kiosk or your syringes in there, and they'll be picked up and safely disposed of.
Gotcha. Something else I wanted to ask, Krystal, is where do you normally set up outreach tents, and what dates and times are you out there?
Tuesdays, we are at our home site that I like to call it at the corner of 139th Street and St. Anne's Avenue from 10 a.m. to 2 p.m. Fridays, we are at the corner of 148th and Bergen. It's near the Hub and 3rd Avenue. We're there from 11:30 to 2:30 p.m. And Fridays, we're back at our home site at 139th and St. Anne's Avenue from 3:30 p.m. to 6:30 p.m. And there, individuals can get syringe access, naloxone kits, warm meals. They can get access to confidential testing. They can get access to case management services and referrals to any service coordination that they may need.
And that's no questions asked, as anyone who needs the services will receive them, right, Krystal?
Yes, it's one who needs the services. So our syringe access program is for those who use syringes. They would need to qualify for the program. But we also have a high-risk women's program for any woman who is engaging in high-risk behaviors or feels that they are in danger because of a domestic violence situation. But also our testing is for community members. So anyone up in the who is in the street and wants to get a confidential test can approach our van and get one at the site.
Good to know. Something else that the St. Anne's Corner of Harm Reduction does is a sanctuary. It's called the Sanctuary. What is it exactly, and how has it helped people heal and rest?
So a part of harm reduction, we have a holistic approach. So we try to find ways to reduce harm from substance use, however that may be. So acupuncture, auricular acupuncture is actually used for withdrawal symptoms. So that is what the sanctuary is. It's also a safe space for our participants to come and relax and choose. They're in the streets 24/7, and St. Anne's is their home and it's their safe space, and they can come in the sanctuary and get a massage, and they can get warm hot stones on their back that we used to provide. We have a licensed acupuncturist and a part-time acupuncturist at any given time, and it's just a safe space for them, and they really love it. I was actually one that engaged in acupuncture while I was pregnant, and it's amazing.
And is it still open, Krystal, during the pandemic? Can people still access the sanctuary? Like, is it by appointment, or how does it work?
At this moment, we're currently looking for a new licensed acupuncturist, but when we do find that person, it will be by appointment, just so we can reduce exposures and we can keep track of how many people we have in the space at a time.
Gotcha. And another question I wanted to ask is why is it important for the organization to approach this work from an empathetic lens? Just talked a little bit about, using empathy when it comes to harm reduction.
So, substance use is a public health concern, and just like any other public health concern, it is something that we would want to approach someone how if it were us, if it were our mother, our cousins, our sister, our brothers, how would we want to be approached? It is something that should be treated. The war on drugs, I can go on, and I know I have a short period of time. The war on drugs is very punitive, and it doesn't show that any outcomes. So right now we're trying to show people that you can be a substance user, you can still be someone who has empathy yourself.
Right. Well said. Thank you, Krystal. And any programs that we missed that you want to shout out and tell us a little bit more about?
So I do not talk about our Ryan White program, which is for individuals living with HIV. We do get them access to case management and care coordination. We do have our peer delivered syringe exchange peers who go out in the community and bring out syringes to participants who may need them and may not be able to come to the office or the outreach sites. We do again have our women's services unit, and we do provide MAT services. And that scope of MAT is specifically Suboxone or buprenorphine, and we provide that here through telehealth.
Got it. Thank you so much, Krystal, for your time. Before we go, just let us know how people can reach out for support, so the cleanups and more.
Okay, so yeah, so just reach out to me through my email, or you can contact us through Instagram. Our social media consultant will let us know when we have someone who's interested in services, or check out more of our services on our website.
Thank you so much again, Krystal, for your time.
No problem. Thank you.
Krystal A. Montalvo is the co-director of programming at St. Anne's Corner of Harm Reduction. That's all for our show today. I'm your host, Sonyi Lopez, wishing you and your family safety and wellness now and always. Take care.